My name is Vicki Farrar, and I'm the coordinator for access to integrated employment at the Sherlock Center on Disabilities at Rhode Island College. And for this session, I will be your moderator. Also assisting as moderator is Elaine Solicito. Over the past few weeks, the federal government passed legislation to support workers affected by COVID-19 crisis and others. Benefits available through this legislation affect SSI and SSDI benefits differently. We are offering this information session to support informed decision-making. It is important for SSDI beneficiaries and those that support them to understand what COVID-19 benefits are available to them, and if received, the impact on all benefits. Our COVID-19 benefits series include 3 webinars. The first was related to the stimulus payment. The second, hosted yesterday, was around the impact on SSI benefits. And the third is impact on SSDI, which is today's session. All right. So, Elaine, if you could just close that poll.
We had folks that were unable to see the poll, so I needed to relaunch it.
Oh, okay. I'm sorry, I closed it on you.
Okay. All right. So, all right. So
you can relaunch it if you want.
Okay.
All right. Again, as mentioned earlier, this session is being recorded and will be posted along with all of the COVID-19 benefits impact on SSI and SSDI benefits series on the Sherlock Center website on our COVID-19 page. Our agenda today will cover frequently asked questions about COVID-19 benefits. We will review general impact on Social Security benefits, the 6 COVID-19 benefits available and their impact on SSDI, Medicare, Medicaid benefits, and other benefits. We will share benefit-specific resources, including how ABLE accounts can help you save and remain below resource limits, and the availability of work incentive information and benefits counseling. We'll also share COVID-19 fact sheets and other online resources available. During this presentation, there will be a time for question and answers, and as you post questions throughout the session, occasionally we will stop the presentation to address some of those questions. Before I introduce our presenter, I must share our disclaimer. Information about COVID-19 benefits and how they impact Social Security and other benefits is evolving, meaning over time, information rules and requirements may change. We believe the information presented today is accurate as of April 22nd, 2020. During the presentation, we will be recommending resources where you can stay informed, and we encourage you to connect with those resources and join those listservs. I'm pleased today to share with you, and Elaine, at this point, can you take down the poll? I'm pleased to share with you our presenters today. Today's session is sponsored by the Paul V. Sherlock Center on Disabilities at Rhode Island College with support from the Department of Behavioral Health, Developmental Disabilities and Hospitals. And our presenter today is Jean Fay. She's a certified work incentive benefits counselor with over 15 years experience. And she is leading the Work Incentive Planning and Assistance Project here at the Sherlock Center. She is also the mother of an adult child with a disability. I'd also like to thank Chris Colavito, who is not able to be on today's session, but who helped share information in the development of this presentation. So at this time, it's my pleasure to welcome Jean Fay to present on COVID-19 benefits and the impact on SSDI. Welcome, Jean.
Okay, good morning, everyone. I'm glad you could join us this morning to learn more about how COVID-19 benefits will be affecting SSDI benefits. And Vicki, can we see the next slide, please? Okay, so COVID-19 benefits available to Rhode Islanders is actually, I suppose, a little inaccurate because they're not all COVID-19 benefits. Some of these benefits are benefits that have been in place for quite some time, while others are new benefits that have been authorized by the CARES Act. The CARES Act stands for the Coronavirus Aid, Relief, and Economic Security Act. And it has made lots of new benefits available, which will help many families get through this difficult time. So today we'll be talking about unemployment assistance, UI, pandemic unemployment assistance, or PUA. And that's a new benefit that's available for people who are self-employed and others who are not traditionally eligible for unemployment insurance. We'll be discussing temporary disability insurance, which has been in place for some time, as well as temporary caregivers insurance, or TCI, which is also a traditional benefit. A new benefit is a one-time economic impact payment or stimulus payment, which some people have already received and others will be receiving in the next few months, hopefully. And the last benefit we'll talk about is federal pandemic unemployment compensation, or FPUC. Next slide, please. All right, so before we start discussing the benefits, I just want to review very, very quickly a little bit of information about how earnings affect SSDI benefits. Okay, some of you will probably already know about the trial work period, which is a time when beneficiaries can earn as much as they like without any impact on their SSDI benefits. Now, you should know that if a person earns above $910 in a month in gross wages or net earnings from self-employment, the month will be counted as one of their 9 trial work months. In addition, if a person engages in self-employment activities for more than 80 hours, they will also use a trial work month. Now, the end of the trial work period does not necessarily mean that SSDI payments will stop. After the trial work period, SSDI payments only stop if a person is working at what's called SGA level, or substantial gainful activity level. And the amount that may indicate substantial gainful activity is gross monthly wages or net earnings from self-employment that are above $1,260 per month on average. Not everyone will lose their benefits when they earn the $1,260, but it's possible for it to happen. Social Security has what they call countable earnings. This means that they can deduct certain expenses from a person's gross monthly wages or net earnings from self-employment. Some of these include impairment-related work expenses. For example, if a person has to pay for medical equipment or medical supplies, medical services, all of this, or even special transportation, such as the ride van to get to and from work. All of this can be deducted from a person's gross wages, and it's very important that they report this to Social Security. There's also a deduction for subsidies and special conditions, meaning that if a person has a job coach or a coworker or maybe even a manager spends extra time with the person, teaching him how to do things, reminding them to stay on track, so on, that can be considered a subsidy or a special condition. And it can sometimes allow people to earn above this $1,260 per month and still keep their SSDI benefits. So what I would like to do is strongly encourage people who are earning above $910 per month to have benefits counseling. And we'll give you some more information about how you can do that later. But it's very strongly recommended that people earning above $1,260 per month have benefits counseling if they have not had it recently. Okay, we can move to the next slide, please. Okay, this slide talks about SSDI reporting. As always, people should be reporting all changes in their jobs or earnings to Social Security. This includes if they had a job end before the COVID, or right after the COVID-19 crisis began. That should be reported to Social Security, so they're not assuming that they're still working. They should report any significant increases or decreases in earnings. They should report if they start receiving unemployment insurance, especially and including the $600 a week payments that they may be getting from the federal government. They should report pandemic unemployment assistance. They should report TDI, temporary caregiver insurance, and if they're receiving compensation from their employer, even though they are not working, they should tell Social Security that although their paychecks may look the same, they are not working in order to earn this money. If they get unemployment insurance or pandemic unemployment assistance, they need to notify Social Security when the federal $600 payments stop. Social Security has no automatic way of knowing things that the state does, unfortunately. And if they do, they only find out about it way after the fact. So the person has to do this themselves, or with some of you may be supporting people to do these things. They also have to report temporary caregiver insurance and any new jobs or earnings during the COVID-19 crisis. Okay, we can move on to slide 7.
Jean, before we move on to the next segment, the question is, does IRWI and subsidy special conditions apply to parents with children under 18?
If the parent is collecting SSDI benefits, they would still want to report IRWIs and subsidies if they're receiving the SSDI, yes. Any person receiving SSDI benefits. All right, so the next slide, now we're going to begin talking about the actual benefits. And one of the big ones is unemployment insurance. So this is referring to the regular uninsurance program that has unemployment insurance program that has been in effect for quite some time. In order to be eligible for this benefit, you must have been working prior to COVID-19 and you were either laid off or your employer said, don't come to work, and you're not receiving any compensation. Your place of business must have been closed, or you must stay at home to care for dependents for very specific reasons, which we'll discuss later. Okay, there are eligibility factors that you should be aware of. You have to have worked for a certain amount of time, which is called your base period, and you must have had a certain amount of earnings during your base period. You must also be able and available to work. So rather than go into all those details, I've given you a link of www.dlt.ri.gov/unemployment insurance/. And I suggest that you read the COVID-19 unemployment insurance FAQ that you can access easily from that website. It'll give you all the specifics. Next slide, please. Okay, this is an important topic. Unemployment insurance if you quit your job. Somehow many people are under the illusion that because the unemployment insurance is pretty high right now, they can just quit their jobs and say they were afraid of COVID-19 and they can get unemployment insurance. Unfortunately, this is not true. You have to quit your job for good cause. So some examples of good cause might be that your doctor advises you to quit because you are at high risk, probably because of your age or because of a specific health condition that you have. Another example of good cause is that you are the sole caregiver for someone who has no place to receive care because the schools or daycare programs are closed, and this person is unable to stay at home alone. Slide 10, please. Okay. This slide discusses the amount of the unemployment insurance you may receive. So the amount that you get from Rhode Island will depend on the length of employment and the amount that you earned when you were working. So the longer you've worked and the higher your income was when working, the higher your payment is likely to be. The minimum payment at this time is $53 per week, and the maximum payment is $586 per week. However, due to these really difficult times, the federal government is trying to make people whole. In other words, they're trying to allow them to have almost as much money or more sometimes than they had when they were working by legislating the Federal Pandemic Unemployment Compensation Program, FPUC. And this was also authorized by the Coronavirus Aid, Relief, and Economic Security Act. What it does is that it provides an additional $600 per week to everyone who is eligible for unemployment insurance. And that will last until July 31st, 2020. So that means that even if you're receiving the $53 per week, you're going to get an additional $600 per week. And that's not per month, it's per week, tacked on to that $53. So you'll be able to get more like $2,800 per month instead of 200 something per month. So this is a huge benefit to people during this time. But remember, it's temporary. As of now, it's only expected to last until July 31st. Slide 11, please. This talks about the length of the payments. How long will you receive on insurance payments? Rhode Island traditionally allows 26 weeks of unemployment insurance, but the CARES Act has also provided for a 13-week extension to the state unemployment insurance. And this program is called the Pandemic Emergency Unemployment Compensation Benefit. Now, this will end on December 31st, 2020. So some people may not get the full 39 weeks if they didn't apply right at the start. But people who applied earlier will get up to the full 39 weeks of unemployment insurance benefits. But remember that the $600 additional payments will end at the end of July. Can we see slide 12, please? Now this slide talks about pandemic unemployment assistance, which is a really great unemployment-like benefit. This benefit is a benefit for people who are not eligible for traditional unemployment insurance, such as gig economy workers, contract workers who get a 1099, small business owners, person who is a worker for hire, self-employed individuals, okay? In addition to that, this may be available to people who were denied regular unemployment insurance because their earnings were inconsistent or insufficient. So if you've applied for unemployment insurance or your client has applied for unemployment insurance and been rejected because they didn't have enough, they hadn't worked long enough or hadn't earned enough money, you should encourage them to apply for this program, Pandemic Unemployment Assistance. Okay. Those who are seeking part-time employment but have not been able to find a job may also be eligible for this program. So basically it opens up unemployment to almost, I don't want to say everyone, but to many, many people who've been trying to work but right now have very little or no income. You can also get this if you have been working as a contract worker, and you're still working, but your workflow has really kind of slowed down. So you're partially unemployed. You can get some of this pandemic unemployment assistance, which will include the $600 until the end of July. And the link to apply for that is www.dlt.rri.gov/UI/. And again, read the COVID-19 unemployment insurance FAQ for details about the Pandemic Unemployment Assistance Program. Slide 13, please. Pandemic Unemployment Assistance. Okay, now this is the program that allows people to collect the additional $600 a week in their unemployment compensation benefits. Okay, and as I said, it will only last until July 31st, 2020, and some people may be able to collect up to 39 weeks until December 31st. Next slide, please. Okay, so now it's time to talk about the impact of unemployment insurance and PUA on SSDI payments. The good news is that both these benefits will be counted as unearned income. That means income that a person does not perform any work in order to receive. So, since SSDI is an insurance program, only earned income, wages, or net earnings from self-employment will affect SSDI. So, person will be able to collect their unemployment or insurance as well as their SSDI payments, or pandemic unemployment assistance as well as their SSDI payments. So some families or some individuals are going to find themselves more financially comfortable than usual during this crisis period, especially until July 31st. Slide 15, please. Okay, now how about Medicaid? People have a lot of concerns about their Medicaid. During the COVID-19 emergency period, you can collect unemployment insurance or PUA, as well as your SSDI, without losing Medicaid. Now, I know that not all people on SSDI have Medicaid, but there are a large number of people who do, primarily because in many cases, the SSDI payment was low and they were eligible for Medicaid, or they were eligible for the Sherlock plan, which is a Medicaid program for people with disabilities who work. People should be aware that during the COVID-19 emergency period, Rhode Island is not allowed to stop anyone's Medicaid. So the rule is that if they had Medicaid before, I believe I put May 18th. I'm sorry, that's an error. It should be March 18th. I just saw this now. So if they had Medicaid before March 18th, or if they become eligible during the emergency period, the state is prohibited from stopping their Medicaid. Unfortunately, at this time, we don't know when the emergency period will end. So it is possible that a person's Medicaid could be affected at some point down the road, and we'll try to keep information on the Sherlock Center website to alert you if we find out that the emergency period is expected to end. Slide 16, please.
Jean, we have another question.
Okay.
If someone's predominant income is from self-employment, but also has a small regular job earning roughly $200 a month, which they have not lost this job, would they be able to collect unemployment for the self-employed hours?
I believe, again, This is all very new to me, so I don't have all the answers, but I think so. I think that the person should definitely, I think there are places on the application where they can collect. So this person should apply for the Pandemic Unemployment Assistance Program and explain on the application what their situation is. Okay, so now we get to the Pandemic Unemployment Assistance extra payment of $600 a week. Okay, now this is unearned income, and it may affect some benefits, such as SNAP benefits and HUD rent subsidies. Although the rent payment can never be more than the fair market value for the house or apartment. Okay, you should also be aware that unemployment insurance and pandemic unemployment assistance are taxable income. These benefits will not affect eligibility for Medicaid or for Right Care, which is a health insurance program for children and families during this COVID-19 emergency period. Now, just a little note about this slide. We are finding that this information is changing almost daily. And last night we had someone who works for HUD say that on Monday they changed the rules and that HUD can no longer count this extra $600 toward increased rent. So since that hasn't yet been verified, and since I can't get a response about the SNAP benefits, this might change. And again, we'll note it on the Sherlock Center website if we find that a person's SNAP benefits and HUD rent subsidies will definitely not be impacted. So that would be really good news for people.
Jean, we have another question. If someone is in assisted living or a nursing home, are they eligible for the stimulus check?
My honest answer is I do not know.
And for those questions that we don't know the answer to, we will do some exploration after the presentation. And when we do our follow-up email to give you the links to all of the materials, we will answer the question. And if we still don't know the answer, we'll tell you that we don't know the answer. So thank you for the questions.
All right, so now we will talk about temporary disability insurance, or TDI. TDI is a benefit for people who experience an illness or injury due to a non-work-related activity, and it's funded by the Rhode Island taxpayers. So this is a traditional benefit that's available in Rhode Island. You can apply for TDI if you're ill or if you're advised to quarantine. The minimum TDI payment is $98 a week. That was as of July 1st, 2019. And the maximum payment is $867 a week as of July 1st, 2019. And you can collect TDI until you receive a payment amount that is equal to 30 weeks of your full earnings from work. You can also get a little more money if you have dependents at home, living at home. So for more information and to apply for TDI, you can go to www.dlt.ri.gov/TDI. Okay, you can move to the next slide, please. Now we look at the impact of TDI on SSDI and Medicare. Now this one is a little confusing. Even though it's unearned income, there is a rule that says that the total of TDI and SSDI combined is not allowed to be more than 80% of a person's previous average earnings. So Social Security does some calculations to determine what a person's previous average earnings are. And if the total of your TDI and SSDI would come out to more than that, then Social Security does what's called an offset to SSDI. They will reduce your they will reduce your SSDI payment temporarily while you're receiving the TDI payments. However, you'll never receive less in total income than you and your family received in SSDI benefits before the TDI began. And it's possible that you might receive more. And your Medicare will also continue while you're collecting TDI. Now, I just noticed a comment that TDI is not available to all. That's true. I believe that you have to work for a business that, that pays into the TDI system in order to be eligible. So again, this is general information. You can read more on each website about whether you may be you think you might be eligible. And the thing is, it never hurts to apply for a benefit if you think you may be eligible. And if the answer is no, the answer is no. But if you're not sure, my advice is to go ahead and apply. They'll tell you if you're not eligible.
Jean, we also had somebody do an anecdotal report saying that their non-disabled in-laws each got a stimulus check for a total of $2,400. One lived in assisted living and the other one was in a nursing home. So we will follow up to confirm that, but that's somebody's personal experience.
Taxable, TDI. Just a reminder that TDI is considered, it's not subject to federal or state income taxes. All right, we can look at the next slide.
We have one more question. Do you know if there will be a paper or pen way to request the economic stimulus payment for SSI non-filers? I am thinking of the poor residential coordinators who would have to go online and create an account for every person they support who falls in this category.
I am not aware of anything like that. People are being strongly encouraged to go online. Unfortunately, if people want to claim the $500 payments for children and they're on SSDI, the period of time when they can claim this has passed. Now, this applies to people who have who did not file a tax return in 2018 or 2019 and who have dependent children under age 17. They were supposed to go to a special website, IRS website, and claim their children. If they didn't do it by yesterday at noontime, they may get their own payments, but they are going to have to wait to get their children's payments. All right, so now we're moving on to temporary caregivers insurance, or TCI. This is a benefit that offers partial income replacement to individuals who are caring for a seriously ill child, spouse, or domestic partner, parent or parent-in-law, grandparent, or bonding with a newborn child, a new adopted child, or a new foster care child. So for information about TCI, you must apply to www.dlt.ri.gov/TDI/. Next slide, please. So with TCI, you can collect that benefit for only 4 weeks, and not everyone will be eligible for it. Again, I believe that you must be participating in this, your employer must participate in this program. TCI will not affect SSDI or Medicare. It will not affect Medicaid during the COVID-19 emergency period, but it may affect SNAP or HUD rental subsidies and so on. It is, unlike TDI, TCI is subject to state and federal income taxes. And the next slide, please. This week, I received information that SNAP benefits may be available to some Rhode Island, more SNAP benefits may be available to some Rhode Island families. So families with one or more children who have lost access to free or reduced price school lunches will be able to get some extra SNAP benefits. And these benefits will be provided to both people who had been receiving SNAP benefits and to people whose children are eligible for free or reduced price school lunches who have not in the past been eligible for SNAP benefits. These are called non-SNAP households. So the amount per child per day will be $5.70, which is reimbursement for the cost of breakfast and lunch. These reimbursements will go back to March 16th. So families should be receiving payments of $193.80 per child going back to March 16th. These will be added to the EBT card that they already possess if they are a SNAP household. If they're not a SNAP household at this time, they should receive a new EBT card that is preloaded. It's called a PEBT, pandemic EBT card, loaded with $193.80. And this will continue for some time, although I neglected to note the date that will end. If anybody knows the date that will end, feel free to post it in chat. All right, next slide. Now we're going to just talk very briefly about the stimulus payment, or it's also called the economic impact payment. We did do a longer presentation on this topic last week, I think, and that is available on the Sherlock Center website. So as most of you know already, people will be receiving a one-time payment of $1,200. Married couples who file jointly will get $2,400. And there will be payments available for dependent children under age 17 of $500 each. Now, no payment will be made if there's an adult in the family who was claimed as a dependent. The language actually says no payment if adult could be claimed as a dependent. So I am not really sure if you have a disabled son or daughter who is an adult and you did not claim them on your tax return, even though you could have claimed them, I'm not certain what will happen there. I'm in that position myself, wondering if my daughter will get a stimulus payment. So we'll have to see. And I can't seem to find an answer to that question. Again, if anyone knows, let us know, please. Okay. The stimulus payments, the good news is that they will not be counted as income at all, and they will, by any benefit programs, and they will not be counted as resources for 12 months. They will have no effect on SSI, SSDI, Medicaid, Medicare, SNAP, or HUD housing. The 12-month resource limit is important to note. For more information about these payments, you can go to www.irs.gov/coronavirus tax relief and economic impact payments. So we've provided the link on slide 23 for that. And slide 24. Let's see, slide 24. Oh, before I do slide 24, we got some news from Lisa Carter that can you put that back up, Elaine? That little chat response from Lisa. I don't know if you can. It was about when the extra SNAP benefits would end. Okay, so the SNAP benefits will end when schools reopen, or in June if schools, I assume that if schools are probably still closed. All right, so that will be until the summer, I guess. And then who knows, maybe there will be a summer program available as well. As savings or resource limits, remember that if the person has SSI or they don't have SSI, but they do have Medicaid, there are resource limits. If you have SSI in addition to your SSDI, then your resource limit will be the SSI resource limit of $2,000. Other people have resource limits that are a little higher, but they're usually aware. People who apply to DHS, I believe they have a $4,000 resource limit or a $6,000 resource limit if they're married. So this can become a problem for people. And I've seen people go out and spend money that they didn't really want to spend just because to save their, just because they didn't want to lose their Medicaid benefits. So a possible solution for some people, especially those who became disabled before age 26, is to open an ABLE account to be able to save some of this extra money that they may be receiving. For example, some stimulus funds or the $600 in unemployment benefits if they don't need it at this time. So can we see slide 25, please? All right, so in order to save without fear of losing SSI or Medicaid and achieving a better life experience, or ABLE account may be a solution. Remember that as of now, the person must have been disabled before age 26. You can save up to $15,000 per year. If you are employed, you can save up to an additional $12,500 per year, or your total compensation for the taxable year, whichever is less. You can save in your ABLE account up to $100,000 before your SSI cash payment starts to be affected. But you can save even more than the $100,000 without having any impact on your Medicaid. Now, the funds in an ABLE account must be used for disability-related expenses, and some of these might include education or job training, health-related expenses, home maintenance and repairs, and so on. So they believe, attorneys have said that they believe they're going to be very liberal in their interpretation of what disability-related expenses are. So I think an ABLE account is really a wonderful way for people to be able to set aside some extra money for times when they may need it in the future. Slide 26, please. Again, it's about the ABLE. Okay, this is how you can get more information about ABLE accounts, and you can visit ri.savewithable.com to learn more about the program, to request an information kit, or to enroll online. And just a little personal thing, I'm very bad with technology, as Vicki will tell you, and I did go online to open an ABLE account for my daughter recently, and I was very surprised at how easy it was to do. So you can't just go to any bank and open an ABLE account, but you can do it quite easily online. Or you can also call 888-609-8915 to speak with the program representative. We believe that in the future, Chris Civitalo, who unfortunately could not be here with us this morning, will be doing a presentation about the ABLE account, which will also be posted on the Sherlock Center website. We don't know how soon this will be, but hopefully within a reasonably brief period of time, he'll be talking more about ABLE and he'll be able to answer your questions. Okay, so that is, I am finished with my little spiel. If anyone has questions, I'd be happy to try to answer them.
So as people are gathering some of their questions, Ann Leclerc posted in the chat that the IRS announced that it will work with the Social Security Administration to ensure that SSI recipients automatically receive stimulus checks, and that the IRS had initially signaled that SSI recipients would need to file through the portal, where recipients would need to enter the data in lieu of a tax return. But now the IRS confirmed that the SSI recipients will receive a $1,200 economic impact payment with no further action needed on their part. SSI beneficiaries with dependent children will still need to use the IRS portal to access that credit.
And just to mention that credit has to be, they have to do that by, at least the recent information was that they have to do that by the end of April. They haven't announced an exact date, but it will definitely be by the end of April. So if you're working with SSI beneficiaries who have dependent children and they haven't filed tax returns in a few years, if they really need those $500 payments, they should go to that portal.
And then Dr. Alba is reporting several different things related to the stimulus check. And what I'll do is include that in the follow-up information when we send that out. We'll send both of those additions in the follow-up email that we send out. All right, anybody else have a question? If you are coming up with questions, what we'll do is I'll continue. I will continue with the presentation, and as the questions come in, we'll go back to them. All right. So in regards to benefits counseling or benefits information, we know that there are many myths out there about how working can impact Social Security benefits. So we encourage people to stay informed about that. And the Sherlock Center offers work incentive information sessions as well as individual benefits counseling. And that's available through the Sherlock Center. We encourage you to join our mailing lists when we announce updates and when sessions are available. To access benefits counseling, we encourage you to call the Ticket to Work helpline at 1-866-968-7842 or through TTY 1-866-833-2967, or you could also contact Jean Fay at the Sherlock Center. For people with SSDI, we encourage people to get benefits counseling if they're earning above $910 per month. And we also strongly recommend that they get benefits counseling if they're earning over $1,260 per month. So in closing, a couple of highlights and some resources, and then we'll also release our poll, is that today we hope that this presentation has increased your knowledge about COVID-19 and the impact on SSDI benefits. The importance of reporting changes to your benefits remains, so please note that. Also that adult recipients will receive stimulus payments unless they're claimed as a dependent. That the Medicaid will continue during the crisis. That ABLE accounts can be a way for people to save, and so those and keep you below resource limits for SSI Medicaid, and also to stay informed. Join the mailing lists and other government pages that will keep you informed of changes as things go forward. Resources that we've made available through links and are also posted on the Sherlock Center's COVID-19 webpage is the Social Security COVID-19 link, the IRS link, the Rhode Island Able account link, the Rhode Island Disability Rights link, the Economic Progress Institute link. They're posting a lot of good stuff recently, as well as the Sherlock Center on Disabilities.
Somebody's saying, are there any changes to the beneficiary allotment?
I am not quite sure what is meant by that. If you mean, will the amounts of SSDI payments be changing? I haven't heard any information to suggest that that is the case. And one thing I did want to mention is that many people are receiving extra additional pay as a result of working at this time because of the danger. Social Security has not made the decision to take that into any special consideration. So some people who were not working at SGA level before, because of this extra $2 or $4 or whatever they're receiving per hour, should definitely be careful if they need to keep their benefits, because these extra earnings could cause their SSDI payments to be suspended. In some cases, they'll be able to be restarted in the future, but someone in that situation should definitely request benefits counseling.
And also there's another question. As a rep payee company, we have lots of people we receive benefits for each month. Will these payments be sent to the same way as their benefits? We do not file taxes for most of these individuals either.
Well, to the best of our knowledge, stimulus, are you talking about stimulus payments? I imagine you are. The stimulus payments should be coming the same way as unemployment, the same way as regular Social Security payments come. And that's the best information we have. If we learn anything new about that, we'll let you know.
Okay. The person that had asked the question about the beneficiary allotment provided a little more detail. She said the rep payee for her son who gets beneficiary benefits from his father's SSDI in place of child support. So
you're talking about the amount that the person gets on a parent's record as that fills in for child support. I don't think that I haven't come across any information to signifying that that will change.
Thank you. That was it for questions here.
All right. So we have a poll evaluation up. How satisfied were you with today's webinar? So if you could take a minute to make your selection. And we'd like to remind you again that today's session will be posted on the Sherlock Center's website with closed captioning, and that will be available in several days. It takes us a while to transition that to add the closed captioning. But also, in the meantime, the PowerPoints from today's sessions and fact sheets that the Sherlock Center has developed are currently posted on the Sherlock Center website. In addition, we will be sending out a follow-up email for everyone who registered for this webinar. And with that, we will provide any clarification to questions that were asked and anything else that we learn that may impact the material that is presented.